Hey everybody, today I'd like to talk about panic attacks. Symptoms of a panic attack include heart rate increase, feeling like your heart's pounding out of your chest, feeling like you're going to pass out, dizzy, lightheaded, tunnel vision, muscle tension, those types of things. And if you've had a panic attack, you know what I'm talking about. So I'm going to talk to you about some things you can do for a panic attack, and some things you probably shouldn't do for a panic attack also. First thing you do is identify the symptoms of a panic attack. So first, you need to figure out what's happening. The thing that freaks people out the most is not knowing what's happening. They think they're having a heart attack and they end up going to the emergency room, and then the ER says that you're fine, there's nothing wrong with you, or you're seeing a counselor, that kind of thing. So you first have to identify it, and then you have to accept that you're having a panic attack. Once a panic attack is set into motion, you're not really going to be able to stop it. You simply just have to wait it out. It will rise, it'll hit its peak, and then it will come back down. You have to allow that to happen. The more you try to control it, the worse you could actually make it. Because the irony of that is that trying to control things too much could be contributing to a panic attack, which we would try to work that out if you were to do a counseling session. So you identify it, you accept it, and you got to wait it out. You could try some breathing techniques, progressive muscle relaxation, meditation, those types of things. They're all good. They're more like a maintenance type thing though. So they would be good if your anxiety is a 3 or a 4. When you get to the level of a full-blown anxiety attack, they're probably not going to work terribly well. They may help a little bit. Your best bet is to wait it out. If you're in a situation and you can't get out of it, you just have to wait. You have to wait till it passes. It will pass. You're not going to die. You're probably not going to pass out. You just have to wait. People want to do something about it, and I get that. The thing you do about it, though, is to prevent it from happening again would be to work on your anxiety levels, your stress levels, exercise. I mean, some type of chemicals like alcohol and different drugs can trigger panic attack symptoms. So 3 things you got to do for a panic attack. 1, we already talked about it, identify it, accept it, wait it out. Another thing I'd like to say too is if at all possible you want to stay in a situation. You don't want to leave as soon as you have a panic attack coming on, because you will reinforce avoidance. This is a big problem. So once you start avoiding things, if you avoid stores because you had a panic attack in Walmart or something, then you're going to avoid other stores, and then you may avoid leaving the house, and then you may avoid certain rooms of your house. Your world can get pretty small if you continue to do that. Always go back to whatever the situation was that happened. Identifying triggers is always important, but sometimes people say they don't know what the trigger was. They just know that they had a panic attack. I'm a trauma therapist, so I usually go with unprocessed trauma. Stuff from childhood, some stuff from adulthood. After people have maybe a car wreck or something like that, they can start having some panic attack symptoms, which can be, trauma also. So, in a clinical setting, we can usually work that out. But in general, like I said, those 3 things are the way to handle it. Any questions, feel free to email me on my website at choicesclinicalcounseling.com. And I hope this was helpful. Thanks for your time.